Welcome to Arogyam Katta, new initiative of FEQH. It is said that prevention is better than cure. So the purpose of Arogyam Katta is to how to prevent diseases, how to live a healthy and happy life. So we will be inviting doctors from various fraternities who will talk about more than cure. Our focus will be how to care and how to prevent diseases. Thank you. Be with us. If you have any suggestions, please feel free to write us. We will definitely try and implement them as possible. Good afternoon. Welcome to the new edition of Arogyam Katta. Today we have with us Dr. Narendra Ddedhia, who has been the head of department in JJ Medical College for more than 2 decades. He also happens to be honorary physician to the governor of Maharashtra. We are lucky to have him here. Thank you for coming, Dr. Dedhia.
Thank you very much.
Now, you are a nephrologist. What does nephrology mean?
Nephrology means physician of kidney.
Okay.
Kidney che doctor. So that's the nephrology. There are 2 parts in that. One is a physician and one is a surgeon. So nephrologist will be physician and urologist will be surgeon.
Surgeon. Okay, both deal with, so you don't operate.
Yeah, we do very specific things in the surgical side and intervention. That intervention nephrology is a now newly developed branch.
Okay.
So there are lots of intervention are done in the field of nephrology, such as vascular access has been closed down, then we want to open the vascular access. So that can be done. Even making of the fistula also now has been taken up by the nephrologist. And so this is a new branch. So this is a type of where the surgical skill is required. Starting the dialysis, putting the lines for the dialysis, again that usually nephrologist does. And when we talk about the kidney transplant, main surgical work has been done by the urologist, but the handling of the kidney, examining of the kidney, and then handing over to the surgeons is done by the nephrologist.
Okay. Now tell me, nephrology is a disease of kidney. Basically you handle disease of kidney. Are there initial symptoms that suddenly I need to know that my kidneys are spoiled and I need to go through dialysis, or are there any initially symptoms that may need for investigation?
I think it's a very good question. Majority of the time way you say that the kidney means kidney failure. There are so many diseases are there in the kidney apart from the kidney failure.
I see.
So kidney failure is a one part, but there are so many other diseases like glomerulonephritis, like urinary tract infection, so on. There are so many things. In fact, hypertension also usually comes as a part of the kidney. Kidney and blood pressure are very closely linked. So that is also a very important part for the kidney. So there are so many diseases, but yes, very rightly you say that is there any initial symptoms of kidney failure?
Even not kidney failure, that somebody is entering into kidney diseases.
Yeah, so now again there will be a different disease will have a different symptom.
Okay.
But I think along with that you ask about the suddenly patient goes on dialysis or something. So dialysis required when the person is having kidney failure. So what we say that renal replacement therapy. So once the kidney totally fails, we need to have a renal replacement therapy. So renal replacement therapy can be dialysis, then a different types of dialysis, and then it can be transplant. So these are the modes of the renal replacement therapy. Now coming back to your original question about the symptoms, unfortunately for the beginning of the kidney disease, there are hardly any symptoms. And that's the reason why usually patient is not caught in the early stage of the kidney failure. Kidney failure has a various stage 1, 2, 3, 4 and 5. So if we catch the patient in an early stage, we can do a lot of wonder to the patient, we can do a lot of good thing to the patient, and we can help him to preserve the remaining kidney function or remaining residual kidney. So that is a very, very important part, and especially the country like India, still the majority of populations are paying the medical treatment from their own pocket. I think it's important that conservative treatment should reach to everybody, and we can postpone or we can delay the requirement of the dialysis. And that can be done if properly the patient follows.
Are there any lifestyle factors involved into kidney disease?
Yes, quite a lot. And as we know today, diabetes, blood pressure, both are the product of the lifestyle things. And India is we say that India is a big house for the diabetes. Almost the majority of the diabetic patients are in India, or the number-wise majority of the diabetic patients are in India. Also, I will say almost 50% of the population above age of 40, either they have a diabetes or they have hypertension or they have both. Now, and that becomes the basic of the kidney failure. So that is the basic etiology or the basic risk factor for the kidney failure.
Is genetics also involved?
It does play some part directly and some part indirectly. Directly, there are few diseases which have been transmitted in the family. Like one of the common is a polycystic kidney disease. So that is transmitted through the genetically. So what we call as autosomal dominant disease. So it is transmitted. But the other things are indirectly. So if the family history of diabetes is there, family history of blood pressure is there, usually they are going to get the diabetes or blood pressure. And again, those people can become a candidate for the kidney problems. So this may be indirectly or somehow it affects.
You said there are various types of dialysis. Is that so?
Yeah.
We thought diabetes is one.
Yes, you are right. Majority of time in our country, we know that dialysis is a hemodialysis.
Okay.
But there is something known as a peritoneal dialysis, which is not popular in our country, but especially the Western world, quite a lot of patients are there on the peritoneal dialysis. Both the types, peritoneal dialysis or hemodialysis, they have their own plus points and the minus points. So yes, but then in our country, the hemodialysis is the most popular, most cheaper, and at the same time nowadays available at many places.
Now tell me, normally a dialysis cycle, you call it cycle, right, or event, how much does it cost?
I think that's a very, again, interesting questions. And but approximately actual cost of the dialysis will come to the person who is doing, or the company who is doing, or the hospital who is doing, will be around anywhere between 1,000 to 1,200 rupees.
Okay. That's a cost of
the dialysis material, which doesn't include the cost of the land or the premises.
No, I mean it's the cost.
And which doesn't include the infrastructure costs like machines or that. But it does include the salary of the staff, the electricity, and the material which is required to be used.
So that means undergoing a dialysis is a very expensive affair.
Yes, it is a fairly expensive affair, but still India is one of the cheapest center for the dialysis. And there are lots of things has been done by various people, including me, to make the dialysis affordable. And in fact, here there is an interesting thing which I will like to mention, because that was my baby, that Bombay model of dialysis. This I am talking about the 30 years back. So that time Mumbai was known as a Bombay model of dialysis, and which was initiated by me, and now it become Mumbai is the place where we say everything is costly except the dialysis. And dialysis is the cheapest in Mumbai. in Mumbai, the dialysis will be available almost at the free of the charge at many of the few charitable hospitals also.
Uh-huh. Now, I believe I have read somewhere about you that you prompted your friends and other family members to donate some dialysis cycles to on your birthday, or is that what is that about?
So that was something called as a Tithi scheme.
Tithi.
Tithi scheme. So we are Hindu.
Tithi is our Hindus.
In Hindus religion, that we believe that on your birthday or your father's birthday or in father's Tithi or your wedding day, you want to do something good to the people. And how it can be implemented, this I will now, from this only the Bombay model of dialysis came up. So here I will take a couple of minutes and tell you how it is.
I mean, viewers would like to know about it.
Yeah, so it is very interesting that this is about a story 35 years back. It was very frustrating. I came from the US after my fellowship, started doing nephrology practice in city of Mumbai, and problem started that any patient we diagnose, as we discussed in the beginning, that we usually patient comes pretty late when they are already in a critical state and needed dialysis. So once they come, usually they are going to the ICU. Also in those days, also ICU expenses was pretty high, maybe 10 to 15,000 in those days. Nowadays, in any corporate hospital, 40 to 50,000 will be quite expensive. So first 3 to 4 days he goes into the ICU, maybe 1 or 2 dialysis, and during that time they will spend about 40, 50, 60,000 rupees. So any middle class person's life saving is gone. Then we will say that you need a fistula, you will need a regular dialysis and so on. And then they will start selling some ornaments, they will start selling some land or some rooms or assets and something like that. And they will continue the treatment. Then we'll say that patient will require a lifelong dialysis, 2 dialysis, ideally needed 3 dialysis, but 2 to 3 dialysis in a week.
In a week?
Yes.
Oh, about 10 to 12 in a month?
1 month.
Oh, that must be pretty expensive.
Yes, and that they will do initially for a month, 2 months, 3 months,
Correct.
depend on their financial condition, but then they will start reducing the number of dialysis. Once they start reducing the number of dialysis, their health will deteriorate. And gradually, over a period of 2 months, somebody's 6 months, or somebody couple of years, ultimately he will die. And poor part or bad part or what is the frustrating part was that when the patient is died, by that time economically family is also dying.
Correct.
And that was a very frustrating.
That's called a health shock, I think.
Yes. So this particular thing I presented to the many of the big hospitals where I was attached to their chairmen and trustees, and can we do something? But none of them were interested. Suddenly one of the trustees, Mr. Manubhai said, he was a chairman of the Ruby Mill, and Ruby Mill is a very big organization, big industry in the textile industry. He agreed that yes, and I told him the entire story, what I told you, the life story of any kidney patient, what happened and why it is frustrating. So he asked me 2 questions. What do you want? I said, I want you to call few 4-5 donors. We will present to them, and if they donate something, some patient will be helped. He says, fine, that point I understood. Second, what do you want? He says, I thought if something can become, then we can work out something and do something. So what something? Then I told him that I have in my mind some Tithi scheme. And that time I developed the Tithi scheme, and Tithi scheme was something like that. In those days, interest rate was pretty high. Almost 12 to 15% was the interest rate. So this is 15,000 one Tithi. For a 1 Tithi, 15,000. And if I put that money into the corpus, I will get around 1,800 rupees interest per year as a at the rate of 12%.
Almost 2 cycles of that.
So those days the dialysis, this I'm talking about the 35 years back,
Oh.
cost was coming around 600 rupees per cycle, was the working cost for the requirement. So 3 dialysis I can get free on that particular tithi if I keep this money in a corpus forever.
That's
That
a
was my
perpetual.
idea.
That would be perpetual.
Perpetual. So that was my idea. And he agreed, it is a brilliant idea, so we can do that. So he said, now can you do one more thing? That whatever the entire story of the patient you told me, that kidney patient, can you have a PowerPoint presentation? Those days again PowerPoint presentation was not that so common. I said, yeah, I will do it. He said, I will tell you within a month. He was a Jain, I was also a Jain. Pollution was coming. Pollution is the biggest religious celebration for the Jain people. He booked the Tejpal auditorium. Now probably the people from the Mumbai can think about that. And all the people from the Valkeshwar and those areas were being called. Auditorium was full, more than 1,000 people were there.
Wow.
And he gave me half an hour to present the life story of the kidney patient. And we did that, and you will not believe, nobody had given one tithi. किसी ने बोला मेरा 2 tithi लिखो, 5 लिखो, 10 लिखो, something like that.
I see.
And that day we collected more than 45 lakh rupees in a half an hour. And that was the biggest thing, and entire Jain Clinic Hospital dialysis become free. So that was a birth of the Bombay model of dialysis. And then it was so easy to do. This was not difficult.
Correct.
So many people followed up in Mumbai, and I think that picked up.
Dr. Dedhia, suppose how many for a patient, dialysis patient, normally how many cycles he undergoes? What is the end of that particular process? Or dialysis can be there for years and years after years,
Yes, I think.
provided in a financial stable person.
So yes, now the scenario what I am talking about I can talk about last 4 decades what is happening. That scenario has been changed and changing much for the betterment for the patient. There's a huge improvement. Previously when the patient was paying from their own pocket, and then I told you about the frustration and then came up the various charitable people and institute who are trying to come forward and helping the patient. And now, in fact, the government has tapped in with the various schemes where government also take a load and they try to give a free dialysis to the patient. So, overall scenario that way has improved a lot. Person who is having money, they can take the treatment at anywhere at any cost. But person who doesn't have money, they can also survive well. And here I can tell you that we have one patient for last 23 years on dialysis.
23 years.
23 years on dialysis.
Wow.
He is staying alone. He comes alone. He stays alone, and he is looking after himself alone. So he is independent. What I mean to say is that he is taking dialysis for 23 years and he is independent. So that's the beauty. So that is the quality of dialysis that improved. And another thing he is doing well because he is able to afford, he is able to continue dialysis. Initially with the various trust and charitable things he was getting support, and now he become a part of that government scheme. So he is doing reasonably well. Maybe he is one of the
oldest
survival. But there are quite a lot of patients at our place who are taking dialysis for more than 10-12 years and doing well. So again, to tell that quality of dialysis has improved a lot.
And dialysis process per se has changed, or it is the same old thing, only some equipments have changed? What is the...
There is a definite change in the dialysis equipment, dialysis process. Initially days there was no water treatment. Whatever the water used to come will go, and the huge amount of water patient was exposed. But now that water patient doesn't get directly exposed. First the water get the treatment, and that is what we call as a RO plant. So all the dialysis unit must have the RO plant. and then that water passes through the RO plant, and that water goes to the patient. So that is the major
That's
change.
the major change.
Then the quality of machines also has improved a lot. So we can program the machine, and we can decide how much fluid to be removed, what kind of the blood pressure patient is having, and various alarms are there in the machine. So those things have been definitely improved a lot. So patient have a much smoother dialysis than what it used to be in the past. So definitely those things are on the better, and understanding about the patient's requirement, nutritional part, and so many other things has
Okay.
improved a lot. And yes, that has helped us.
Great. Thank you, Dr. Dedhia, for giving a insight of dialysis. What's a take-home message for common person?
I think that's the most important part at the end of the talk. What the take-home message, that please, if you have a diabetes, if you have a blood pressure, check it regularly. Check your kidney also regularly. See that your creatinine. It's very simple to check the kidney function. That your creatinine is okay or not. Your urine report, which is very simple, is okay or not, and that doesn't cost you more. And I don't say that you do every monthly. You do once in a year also, that is good enough, and it will cost you around 250 to 300 rupees. So please do that. If you are diabetic and blood pressure, try to control that, and try and see that if age out of above 40, simple kidney function should be checked regularly. If somebody is having a beginning of the kidney failure, that I mean that stage 1 or stage 2, your creatinine started just rising, please go to nephrologist, follow the treatment properly, take the medication regularly, do the regular follow-up, then your remaining kidney function, residual kidney function, can be preserved for 10, 15 or 20 or 30 years also. And that's a really big difference. So please be aware of that. Thank you. Thank you.
Thank you very much for being with us. Let's hope we'll have some more insights on kidney and nephrology in days to come.
Yes, always, and I'm there always to help spread the knowledge about the kidney to the general public.
Thank you very much. Thank you.